All right. Hello, everyone, and welcome to the Heartland Daily podcast. And today we're going to be talking about healthcare policy, as we do a couple of times each month. My name is AnneMarie Schieber. I'm the managing editor of Healthcare News, and I'm joined by my cohort, Devon Herrick, who is a healthcare economist who posts for the Goodman Institute Healthcare Blog, writes a lot of good stuff, which we discuss here on the podcast. My goodness, there is so much going on, so much at the federal level, and I want to mention it. We're not going to have time to discuss it. I think we need to devote an entire show to it on vaccine policy. Just about a new development happening every other day, and HHH Secretary Kennedy. Today, we've got some really good hot topics to discuss. The first one is seemingly about something called social determinants in healthcare, but it has led to massive fraud in one state. Devon wrote about that. We're also going to talk about mental health, which you wonder where all the Medicaid money is going, all the healthcare dollars that we spend. Well, it doesn't seem to be going to helping people who are falling apart. And we've seen that in a very violent summer this week with murders and murder-suicides, just been horrible. We're also going to have a discussion on the Trump administration appears to be making a non-move on something that Trump widely talked about in the campaign and early in the year about IVF technology, very expensive fertility treatment that he was trying to get mandated in insurance policies. And then last, we're going to give you a warning that you should do everything you can to avoid getting bitten by a bat, because it's not the bat bite that's going to hurt you, but the bill you'll get from the hospital for a rabies shot. Real interesting what's going on there. All right, let's cut to the chase. Let's talk about massive fraud in Minnesota. Medicaid Housing Assistance Program. Now, you wrote about this, Devon. This broke a couple of weeks ago, and we're now starting to learn unbelievable facts about this, which really kind of started, maybe even before COVID, where they were diverting Medicaid money in the name of social determinants in healthcare. And it was acknowledged, and I believe there is some truth to this, that one component of good health is having adequate, safe housing. That's a great goal. But what ended up happening is we diverted tons of money into Medicaid programs through middlemen, and it led to massive fraud. You have a statistic here, Devon, I'm going to let you say of how much the spending in Medicaid has grown in the state of Minnesota because of this Medicaid Housing Assistance Program. Can you talk about that?
Well, I think it was in 2020, Minnesota was the first state to petition the federal government to divert some of their Medicaid funds to help seniors and disabled people find and keep their housing. Okay, I can see that being, a lot of states are looking into that as well. They projected it would only cost, $2.5 million a year. Well, 4 years later, I guess now it's 5, the annual cost was like 104, 105, 106 million dollars. And they began to investigate because, they have to have a name, they're billing Medicaid under a beneficiary's name. And, I think it was a TV station or some kind of news media outlet was able to contact some of these beneficiaries. And they're like, I don't know what you're talking about. I think one lady said, well, they gave me a toaster or something, like a toaster oven. That's all they did. Well, $105 million a year. And they're finding, I think it was the U.S. attorney that said it's that virtually all of the program is in fact fraud. It's not just the tip of the iceberg, it's the entire iceberg almost is actually being diverted to fraud.
Yeah, he told the Star Tribune, I'm going to read this quote because it was, he's the U.S. attorney, Joe Thompson, and he said, he said, it's the result of widespread failure across nearly every level of leadership in Minnesota. Politicians it's in a different link, Andy. So I know you're trying to find it, but I'll read it to you. Politicians who turned a blind eye, agencies that failed to act, prosecutors and law enforcement who didn't push hard enough, reporters who ignored the story, community leaders who stayed silent, and the public that wanted to believe that it couldn't happen here. Massive millions of dollars going to no help whatsoever to people, and going to middlemen, right? It was done in the name of housing to provide needy people with housing. None of them got probably a dime of it. And it ended up going to these middlemen, corrupt organizations. And we don't know what happened to the money. There's got to be criminal investigations. I hope that they're working on that.
Oh, yeah. And I mean, this is kind of an aside. While digging into housing fraud, they discovered a nutrition program for kids was a massive $400 million fraud. And then they found out that a program to help the autistic was also a massive fraud. So it's not just housing. It is almost every program that has come along since COVID. There's no oversight. And I mean, and I forget now what I think it was. I heard the figure like $400 million on one of these programs. And this one here was 107 million a year. It was supposed to be 2.5. And I mean, wouldn't your first clue, let's say you budgeted for $2.5 million a year, and you're in your first or second year, you're 10 times that. Wouldn't that, at the very least, result in some officials saying, wow, this is either highly successful or it's a big fraud. Let's check into it. Well, they apparently didn't for like 4 to 5 years.
Well, we talk about in free market medicine, it is so much better to give money directly to people because you can avoid the fraud. You don't have control over lump sums of money. And this is what happens with government benevolence programs. You give a lump sum check to a handful of organizations and boom, the money is gone. Mm-hmm. Imagine if you took $104 million and got everybody on Medicaid, every needy person in Minnesota, and split that money up over the last 5 years. The money would have been far better spent. It actually might have gone to housing. Sure, you're going to get some people that will waste those checks, but then over the vast part of, the population, I think you would get much better results, much better benefits. People can pick and choose. Just give them a check, give them a rebate. But to do these programs, how many more examples do we have to have before we open our eyes and say, this is the wrong way to do it?
And what's really sad is that I think it was actually in the food program that as the state began to suspect there was foul play, they tried to stop paying one of the large umbrella organizations that sued and won and made them continue the payments. I mean, the legislature had to act, if I'm not mistaken, to give the local health department, state health department, enough power to put a stop to it.
Right. Like they couldn't even watch their own program.
They're not allowed to.
Yeah. And, we've heard all the crying over Medicaid cuts. The Medicaid cuts were designed to get rid of this kind of stuff, waste and fraud. And the narrative has been that people are going to be left out on the street. Hey, guess what? They already are. We have been spending that money and they aren't being treated. They aren't being taken care of. You can walk down any city and you can see where the money is going. It's going into massive hospital buildings, lavish hospital buildings, and you see distraught, uncared for people walking the streets. It's in every city. So it kind of leads us to our next point, which is the topic of mental health. We have had, a violent summer, and a lot of, just like within the last, in a 4-week period, we had 4 murders, suicides. Let me just kind of read off the list. And then I want to try to connect the dots a little bit. So on July 29th, we had Shane Tomorrow, age 27, going into a New York City building and killing 4 people, including himself, with a shotgun. Now, Shane Tomorrow, the media has been focusing on his letter that he left, saying that he was damaged from football brain injuries. And Alex Berenson wrote a column I thought was real interesting because the media is kind of glossed. They love, first of all, blaming football on this murder-suicide. But Alex Berenson is one of the few people who has pointed out that this individual has a history of mental illness and marijuana use. They found marijuana in the car outside of the building where he shot down these people. And they're just kind of glossing over that. But, Alex Berenson came out with a book. It's really good a couple of years ago, Tell Your Children. And he makes the case. I don't know if we can go into that article. So he wrote a book and he talks about how there are now new studies emerging of how marijuana use interferes with mental illness. And, people who are taking other psychotropic drugs, and we have kind of normalized the use of cannabis, but it is a mind-altering drug. And this guy had a pretty heavy history of using marijuana. No one's brought that up. They keep talking about the football injuries. He was pretty young, and he wasn't even a professional football player. So, we just don't know. A short time after that, so that happened on July 29. On July 28th, one day before, in Michigan, Traverse City, Michigan, a man, a 42-year-old named Bradford Guile, if I'm pronouncing that right, walked into a Walmart and he stabbed 11 people. Now, fortunately, nobody was killed, but this individual was living as a homeless person. His family begged, according to the media, was begging authorities to institutionalize him. He was reported to have paranoid schizophrenia. And my goodness, the family was just trying so hard to get this individual into care. We used to institutionalize people who were falling apart, not just to help them, but to protect the public. And that did not happen. Then we had a lull, and then it was August 8th. My goodness. And we had Patrick Joseph White go to the CDC headquarters in Atlanta and open fire from a sidewalk. Patrick White was age 30. His father apparently was calling 911 at the time because he suspected his son, knowing his son's history, that it could have been his son. It turned out to be his son. It was a murder-suicide in the gunfiring. Police officer before shooting himself. But the gunman here had verbalized thoughts of suicide. And the father had called the police several times about his mental health struggles. I guess this individual was living with his parents, and the police knew about this. And again, there was nothing that could be done. How it was, we have guns and gun control laws don't work, right? He gets a gun and, commits violence. Then the last one, 2 days later, we have a report from an Austin Target store. A 32-year-old named Ethan Ninenecker killed 3 people outside the store. He was stealing cars. This guy has a history of violence and mental illness going back to 2012. He was convicted of weed possession, alcohol use, vandalism, and he's walking out. He's got a career stealing cars and committing acts against people. He killed a grandfather and his granddaughter in the parking lot. Just unbelievable. When I guess they picked him up, he ran away. He stole another car and they found him naked in some building. Just really crazy. There's a really good article on this. We'll give you the link. KUT News talks about the history, unbelievable history of this individual. So we have, the media talking about football head injuries on the CDC thing. They're talking about, so that the shooter in that incident talked about being injured from the COVID vaccine shots. And of course, the media had a heyday with that, saying, see, it's all this vaccine misinformation that caused this guy to commit this violence. But, the question begs to be asked, why are these people not in institutional care? Should we loosen up privacy laws to allow extended family members to keep better tabs on their loved ones and to help them? Can we revise Medicaid in any way to allow more flexibility in substance abuse treatment, mental health treatment? I just don't know what the answer is. What do you think, Devon? Do you have some thoughts on
Well,
this?
you've probably heard years ago, um, during the Reagan administration, we began to close down state institutions. And people say, oh, it's Reagan's fault. Well, no, the government began to close down state institutions for mental illness because they were under fire from the court system, because involuntary commitment is involuntary. So, I mean, at the time, there was not a lot of treatment alternatives. So they were essentially warehoused in a hospital-like institution. And I mean, on the one hand, you had, fewer public meltdowns, but on the other hand, you had, a coercive type of commitment system. And, we would have to change. I don't know. It's really complicated to change federal laws. I mean, the Constitution. I mean, that's essentially. I mean, I'm not saying it can't be done, but it really is difficult to say, how do we involuntarily commit someone if they're a danger to themselves and to other people, and how do we know they're going to be a danger until they've committed the crime? So it's kind of a catch-22, but it seems like we're seeing more of it lately, and I think it's I don't know, it's like a antisocial, aspect of severe mental illness.
Well, it's the autonomy movement in mental health care, and that is a real thing where people are encouraged to be autonomous and have control over their mental health issues. And, you could see the case for that. I mean, we did see some extreme neglect, decades ago in some of these institutions, but the solution was not to shut them down. We shut down treatment. And then, of course, we tied the hands of family members to try to intervene and help their loved ones. We have now very draconian privacy laws. Once an individual turns 18, there is very little you can do to get them committed or force them into some kind of care. I want to point out a really good organization, because so many people are struggling about this. And we also have a big drug abuse problem. So you have untreated mental illness, people self-medicate, and then they get hooked on really dangerous drugs, which exacerbates the problem. This is a really good organization. It's called the Treatment Advocacy Center, and they advocate for better laws to get people treated. One of the things they talk about is outpatient civil commitment. So I understand that we may have a struggle with beds, but this outpatient civil commitment would actually force people to show up and take their drugs for whatever they need. We get a lot of people who go into institutions, they come out and there's no follow-up. We throw them out on the street. Sometimes they don't even have a house to live in, and they stop taking their medication. Tons of articles and resources on that website if you know anybody struggling with that. And a couple of years ago, I read an excellent book called Committed. I don't know if there it is. We'll link to this in the show notes. But it was written by two psychiatrists who deal with this issue a lot. And it's a very neutral book. It presents mental health illness from various perspectives, whether you should be very draconian and force people into care, or you should be more compassionate and allow people more freedom. Commitment is a really difficult thing. And it's a really bad thing to get people, forcing them to do something they don't want to do. The best case scenario is to get them to volunteer for treatment. There is a reason why people are not doing that. Sometimes they have no recognition of their mental illness. So these are things that deserve much more attention, much more research, and we need a better approach, because people are dying. We live in a very violent culture and a lot of untreated illness. And I just don't know, I just hope that we can start taking some of this stuff seriously. All right, let's move on to topic number 3. It appears, so we don't have the article here, but there was an article in the National Review, and it was written about in the Washington Post. But anyway, it was reported that President Trump is backing off on his promise to mandate IVF coverage in health plans. Now, free market people were very much against this because, first of all, IVF coverage is not really healthcare, it's fertility treatment. And it's very expensive, and it's a one-size-fits-all approach. There are other ways to deal with fertility other than IVF coverage. IVF is fraught with ethical concerns, and a lot of people don't support it. So, to come up with a rule that makes all health plans cover this, which we end up all paying for, really raised a lot of eyebrows. And it looks like, but Trump was just really dead set on, expanding IVF treatment in the country. Now it appears he's backing off, which is probably, I think, a good thing. Maybe we come up with ways that people, if people have more control over their healthcare dollars, hey, let them go and get IVF treatment. But to mandate it in an insurance plan just is not the solution. What do you think, Devon?
Well, there used to be an organization years ago that would track mandated benefits. And I forget the exact number now because they changed every year. There's 50 states, obviously. And of course, IVF is one of the popular mandates in recent years. There were over 2,000 mandated benefits across all 50 states. And every time you mandate another benefit, especially an expensive benefit, you're raising the price of insurance premium. So yeah, I don't think any free market economists are in favor of mandating benefits. And really what you'll find quite often is that it's the providers of those services that are lobbying the state legislatures to have their little service covered. And it's just another example of pandering to the state legislatures and the members, the state senators for money, So yeah, I don't know what got Trump onto that idea. I mean, there must have been someone that got his ear and tried to explain how, badly it was needed. And it kind of makes me wonder if maybe it wasn't someone who was connected to a lobbyist that was like, okay, if you could kind of get a little word in edgewise over here, we'll shovel. I don't know. It just seemed very odd.
Yeah. Well, I think his main concern at first was the fertility issue. Births have dropped, and it's getting to a point where it will threaten our population. I mean, we're already seeing that in places like Japan and Italy, Europe. Young women are not having, we don't see large families anymore, and that's going to come back to haunt us. I think we need to divert a little more attention as to why that is the case. Why are women holding off, not having families, people not having families? Is it housing? Could relate to housing. They can't afford housing. People, that's usually a first step before you think about when you get married and want to start a family.
Of course, housing and daycare, but even in countries with universal daycare and subsidized housing, Nordic countries, even Nordic countries are still experiencing the drop in fertility. Yeah. And it's happening in the, in the West, in the first world, the advanced world. And it's just, I think it's a natural phenomenon. As people get wealthier, they have fewer kids and they invest more in each kid. I don't think IVF is going to change that.
Well, there's the issue of desire of whether to have families or not. And then there's the infertility issue. And if women are struggling with getting pregnant, we need to figure out what's going on. What happened? What has led to that? Is it because we're delaying childbirth? Or, there's even consideration that it might be related to the COVID shots. So we really need to nail this down because that's not going to be an easy thing to overturn over the years. And we're now experiencing a generation of families, in their 30s. It's going to be too late for them to get involved. I mean, the other problem too with in vitro fertilization, we mentioned this before, but it's a one size fits all alternative. There's another thing called NAPRO technology, which actually gets to the origins of fertility problems and tries to address those and do it kind of naturally instead of, with the ethically compromised IVF stuff. But there was no mention of that. And, it gets back again of somebody making a determination of how to spend the healthcare dollars. If we had indemnity style insurance or larger HSAs where we could set money aside and make our own healthcare decisions, we would not be discussing this. People would figure out how to address their problems and custom tailor what they need. We shouldn't be paying all these things in health plans. They're very expensive as it is, and they're not needed for a lot of people. So anyway, always comes back to the same thing, doesn't it?
Yeah, it does.
We don't have free healthcare. All right. This is an item that just is going to raise a lot of eyebrows and get people angry. You wrote about this in the blog, about a $21,000 post-exposure rabies shot. Tell us about that.
Well, there was a lady and her father. She was, I forget now her name, but I think it's in my blog post. Anyway, she was vacationing with her father, her father's a doctor, and they were taking photographs of the night sky in Arizona when there were a few bats, flying around, which you would expect. Well, a bat got tangled in her camera, between her camera and her face. And of course, she screamed and the bat flew into her mouth for just a second. I mean, just imagine. And it flew back out. But her father, who's a physician, was like, that's a little bit iffy. The most common way people die of rabies is from a bat bite. There's only about 10 a year. But you probably ought to get the post-exposure rabies vaccine just because rabies is not treatable once it takes a hold. And so like the next day, they went to a hospital in Flagstaff. I assume they went to the ER apparently, and they, gave her story. They gave her the first course of the rabies vaccine with a globulin shot. And see, nowadays it involves 4 shots over the course of several weeks. Well, and then she went somewhere else a few days later in Arizona and got a shot. I think she got a shot in Colorado somewhere. And then when she finally, I think they were from Florida, but when they got the 3rd or 4th shot, I think in New Jersey. Mm-hmm. Well, here's the thing. You add up all 4 shots. And her her prophylactic to make sure she didn't get rabies cost nearly $21,000. She was uninsured. She was a biomedical engineer, and she had lost her job, I think, earlier in the year or maybe late last year. And she was between insurance. But then if you look at all 4 shots, the first shot cost like $15,000. The 3 later shots were $1,000, $1,200, $1,500. It was all. So it's just something that is, it's a fluke, but you still have to ask yourself, why do they get away with charging $15,000 for an emergency, medicine?
Yeah.
That, if a hospital is getting a tax exempt, nonprofits get tax exemption, certain things they should have to provide. I'm not saying for free, but not for $15,000 either. And what really struck me about this story was that a member of my family had not the same thing, but a member of my family like 60 years ago was bitten by an actual rabid skunk. And they survived. Back then you had to get a shot like every day for, I don't know, like 2 or 3 weeks. And I've heard the stories over and over again. Growing up, I never once heard that the cost was excessive.
Right.
Not once.
So, what you have here is hospitals taking advantage of an emergency situation. Yeah. And they do all this cost shifting that we're not even aware of, right? We don't even get our bills until like 30 days out. Who goes into an ER and says, how much is this going to cost before I go forward? They don't even know. The people, if you ask that question, they wouldn't know.
That's right. Yeah, they wouldn't know. And they would still charge you for the ER visit because they talked to you.
Right. And I mean, we've had rabies shots around for decades. It's not exotic treatment, right? There should be no reason why somebody should have to pay $21,000 for a life-saving vaccine that we've had around for many, many years. What it is she went to a hospital. The other places were clinics, right?
Well, it's not clear. We do know she went to the hospital the first time, but also I think she went to at least one hospital for the next 3 shots. And yeah, she got like a $700 bill for the ER and like a $1,200 or $1,000 bill for the shot. But it wasn't 15,000. It was overpriced. It was, but not 15,000. So it's really unconscionable. I mean, if you think that's bad, try getting a rattlesnake bite sometime. And they say that that's, again, because it is a specialized rare occurrence. And so when it does happen, the sky's the limit.
Yeah.
And of course, economists don't like price controls, but at the same time, neither is it a free market transaction to hold someone hostage in an emergency situation.
You don't need price controls when there's competition, when there's choice, and we don't have that. I mean, what this young woman could have done while she was in between jobs is bought herself a cheap short-term plan and paid a couple $100 and get a large deductible. At least she wouldn't be out 21,000. Maybe she'd be out only 5,000. But, we had the last administration, that's something we need to talk about, has obliterated these plans. They were the only thing close to indemnity insurance that we had to Obamacare plans. And that's how I covered my health care. I would buy these plans every 6 months. And fortunately, but they were really used as a catastrophic alternative in case I had a very expensive healthcare bill. I paid for everything else out of pocket and controlled the costs and spent very little on healthcare. But, this young woman felt like there was probably no alternative. We don't really advertise short-term plans. And even if she did, the Biden administration cut them down to 4 months. So if you needed treatment beyond 4 months, you would be really stuck, because if you were sick, you would then have to be underwritten for another policy, and nobody would underwrite you with an ongoing health condition.
Well, and that was the kind of the issue. I think she did try to get a short-term plan, but she'd already faced the event that, she wasn't sick, but you can't really wait to buy a policy until after you've had an event. And so that was an issue. But at the same time, it shouldn't have cost. I mean, her father was a doctor, and even he didn't know that they should have, checked around, maybe gone to an urgent care clinic and maybe even called various ERs or hospitals or clinics and say, we need a globulin shot with a post-exposure rabies vaccine. What's that going to cost?
I know.
I mean, you wouldn't think about that. Or, I mean, I would think about it, but most people probably would not. And it's, $15,000. I mean, I had one of the guys that comments on our blog sometimes, he emails me occasionally, and he said, what we need is healthcare courts. And his point was, sometimes it's so egregious that you need to have a court that can step in and say, that's not quite how this is going to work. And I'm not advocating that because I don't know enough about the topic, but I'm just saying that we need something. We call it a free market, but yet it really is not a free market when you go to the ER and they just say, okay, that's $15,000, please.
Right. And what are you going to do? You're in an emergency. That's the whole point behind, surprise billing. And we did actually try a solution for that. What was it called? The mediation boards, or the baseball style, like when you had a surprise bill, but it didn't work out, because somebody always figures it out and manipulates the process to a way that's advantageous to them and against you. So again,
well, it was poorly designed too. So
true enough. Yes.
That's how they manipulated it.
I'll tell you what, you cannot get away with this stuff if you're paying out of your own pocket. I mean, when do you hear about this stuff like going on with your car? If you have something wrong with your car, you bring it in. And if you think they're going to charge you an outrageous price, first of all, you get the price up front. That's an easy thing to do. And if it's too high, you go down the street and you get another price. You cannot do that in healthcare.
Mm-hmm.
And the whole
And
movement behind price transparency is holding hospitals to their prices. They don't want to do that. They want to do this cost shifting. And, like, I think probably a lot of people would not go on, some of their websites to figure out the prices ahead of time, but at least it would hold the hospitals accountable to the prices they state up front. And then you can fight the bill. But the way it is now, they do cost shifting and they figure out who can pay the max. And that's what your bill is, not whether the treatment is worth that or, for any other factor that would work in a free market exchange.
yeah, I think the Trump administration is trying to force hospitals, and has been since the first administration, to force hospitals and health plans and doctors' office to disclose prices. And of course, hospitals are dragging their feet. They're saying, well, we can't predict this in advance. Well, of course they can. I mean, it's, it's a series, it's a bundle of services for a given diagnoses. It's not impossible to say, okay, we know that for a broken leg, here is what usually goes into it. Oh, okay, yeah, we can look at our data from years past and see that a broken leg cost $3,000 to set.
Yeah.
But they don't compete on price, and that's why they don't do that automatically.
Right. You hire them for a job. Like let's say, like for a carpal tunnel fix, right? They know exactly what they're going to need to do that. And there are places like the Oklahoma Surgical Center. There's one in my backyard that does it and gives you one lump sum. And that's all you're going to pay when you walk in the door. It includes anesthesia, the whole works. The hospitals don't do that. And when they don't do that, that means they lap on stuff for whatever reason that you can't even comment on or have any say on until you get the bill. And that system just doesn't work. And so like the price transparency thing, and they're getting more aggressive about it. In Florida, they're using subpoenas now, going after these hospitals to figure out some of the practices behind their billing. They want Trump wants the hospitals to put this data into machine readable files. Why is that important? Because other websites then can take that data and create other websites so that people can more easily read those prices. You see, I don't know, I can't think of any websites, but there are lots of cost consumer websites that show you where you can get best prices on things. Well, that would happen in healthcare, but the hospitals want to hide that information. They don't want you comparing prices. So I just hope we stay on top of it. We don't anymore see a $21,000 post-exposure rabies vaccine, and we get it done. We fix it.
It would be nice to be able to go to an Orbitz for healthcare, let's say, and and enter your health plan, enter what you need done, and have it tell you, okay, here's a list of 10 hospitals or 10 ambulatory surgery centers or what have you, and here's the lowest price. And I think a lot of people, if they were really worried about the cost of their medical care, would use that if they had the tools and the knowledge that they can do it.
Right. And you could get places like Costco and Amazon to offer more health services, but it's really impossible to nail down prices. And, that's got to change. That's got to change. Anyway, I think we've run out of time here. Boy, we had a lot of stuff to talk about. Yeah, maybe next time we'll get onto the vaccine bandwagon because there's a lot going on there. It's a very controversial subject, but I think we need to kind of share what's been happening. We will have a lot of these links. I'll have the links in the details in the show notes. And in the meantime, thank you for joining us. Stay healthy, stay well, and we'll see you back here in a couple of weeks.